you are doing things that are illegal and unethical and really problematic.
So this video is only going to come out if this can't be resolved behind closed doors. We need you to delete this and stop doing this and scrub the record clean, because this does not end well for us. Well, thank you very much for joining me on this video. I would like to just introduce you and we get an idea of what your qualifications are, because I know people are going to question this.
Sure. My name is Dr. Adrian Walton. I'm a practicing veterinarian of 22 years in the Vancouver, British Columbia area. I am also a keeper of reptiles and have been since 1975. And I have a range of animals from turtles, tortoises, frogs, snakes, and even a Gila monster. Some of my other qualifications is that I am a member of the Canadian Council for Animal Care Committee here in Canada to determine standards of care for reptiles. And I'm also teach a course in animal cruelty investigations, which I use to teach conservation officers, the BCSPCA, and animal welfare groups across Canada.
So the first thing I would like to dive into here is people removing urate stones and blockages at home.
This is one of the few times where you do have a situation where it's a bit of an emergency situation in some cases, but for many people, this is actually a problem of husbandry. And the fact that, say, they have a snake with urate stones, or quite commonly iguanas, they've had a breakdown in their husbandry that led them up to this. These animals are clinically and consistently dehydrated so that these stones form in the first place. But one of the things that I've seen, and I've seen people on various videos do this, they just basically pick up the snake, they squirt varying volumes of, I'm not entirely sure, half the time, some type of lubricant into the animal. And the problem with this is they don't actually know what they're doing. You know, the most common thing you'll see them do is they'll take a enema tube and they put it into the cloaca. And the cloaca is a collection vat. You have the urinary system attached to it, you have the digestive system attached to it, and you have the reproductive system. So when you blindly insert this, you really don't know which tube this is going down. And so what I've oftentimes seen is they push this in, maybe just about this far, they squirt some lubricant in, and it just dribbles back out. So it's not actually lubricating the spot that you need. And then the next thing they do is they just kind of milk the snake to try and move these stones out. Basically, they're trying to recreate the snake's own muscles. Well, the snake's far stronger than you are. So the reason the snake hasn't pushed it out is because of the fact that it hurts. And so you're just overriding the pain receptors to force these things out. And as you're doing that, because you haven't provided enough lubrication, this is ripping and tearing the walls of either the urethra, if it's a snake, or the ovarian or the reproductive system. And you're actually setting yourself up for further problems down the road, because you're going to have scarring, you're going to have the tissue become more friable, so you're at greater risk of tears. So it's a problem in that regard. The other one is because people don't have a medical background, they are unaware of some of the other issues that are going on that a veterinarian would. Now, I'm going to use this as an example. This is an iguana stone. We've got about 4 of these. We threw out a bunch more because we just didn't have the space. This is one of our common ones. But we see these types of stones in some of the large boas, some of the pythons as well. And because this is filling up the coelomic cavity of the animal, what they have on top of it is the blood supply to the back end of the animal. And because this thing's pushing up against it, the blood supply gets squished, flattened. So it's supposed to be like this, and instead it's being squished like this. Now, the snake still has to provide blood to the area of the back end of the animal. So what it does is it basically goes from something like this to something like this. And so what happens is that when you push that stone out, this blood vessel, which is kind of now angled like this above the stone, once you release the stone, it opens up wide. So a blood vessel that used to be like this is now this big. Because you're squeezing without any anesthesia, because you have no pain control on board, blood pressure is through the roof. The heart's beating as fast as it can because it's in pain. So as soon as you remove that stone and it goes like that, huge volumes of blood flow to the back end of the animal, away from the brain. So this puts this animal into shock, hypovolemic shock. There's not enough blood pressure to get blood to the brain until that valve shrinks back to this. And this can take 15, 20 minutes. Now, veterinarians deal with this by making sure the animal has appropriate hydration. And when I talk about hydration, you don't just soak the animal in a tub for a few days ahead of time. That's not hydration. That's just providing water. The snake may drink or may not. No, we will do things like intravenous if we have venous access, or we'll do intracelomic fluids to try and make sure that the animal is well hydrated or even at least slightly overhydrated. We will provide full anesthesia so that, and pain control, so that that heart isn't going because of pain. We can control blood pressure, we control heart rate through anesthetics. So when you see these people holding up the snake after they've removed these massive blockages, which they caused in the first place, then you say, they look and say, oh, look, the snake is calm. No, the snake is in shock. And this is why, as I said before, so many people don't understand what they are doing. And they may be complaining about the price of a veterinarian, but at least a veterinarian knows what's going on with that animal. And let's be honest, trying to pass a watermelon through your rectum is going to be painful for us. So why would you think it wouldn't be painful for a snake?
Yeah, I think there are misconceptions about pain in reptiles in general. I think some people think because there's less of they can't shout and they can't be very vocal about pain, then they associate them with feeling less pain, when obviously that isn't the case.
Well, I use the example of in humans. We didn't think babies felt pain. We didn't give them pain control if we were doing a surgery on an infant up until I think it was 1987. We've learned a lot about reptile pain receptors since then, and we know they feel pain. Now, it is challenging to control that because a lot of our drugs don't work as effectively as they do in, say, mammals, but that doesn't mean that there aren't ways to control it. We can do subcuticular or sub-Q injections of lidocaine. And I've seen people online smear tattoo lidocaine gel on the skin of reptiles. No, it doesn't do anything. You actually have to inject the lidocaine under the skin, and you actually have to know the dosage because lidocaine also affects the heart. And so if you get your dosing wrong, you're going to put the animal into cardiac failure. So it's complicated.
Definitely. I think when people come into the hobby and you have this person who's been breeding for X amount of years, and they see this person as this idol who obviously they value a lot, and they see as an experienced person. And when you see someone do these types of things and say, oh, only an experienced person can do this, then people are led into believing that this is actually what they should be doing. But actually, these people that say that they're the only people that can do it because they're experienced are actually have no experience doing this whatsoever and shouldn't even be going near this.
You're right. Everybody thinks they're an expert. And there's this concept in psychology called the Dunning-Kruger effect, and it's very simplified in the general practice. But the concept is as your experience and knowledge in a field progresses, at the very beginning, you feel like you know a lot more than, say, the average person. We call this the top of Mount Stupid. The truth is those people actually don't know what they're talking about. And then as you learn more, that confidence level drops considerably. And then as you gain more and more expertise, it starts to go up again. And I've been doing this for 22 years, and my confidence level on the Dunning-Kruger effect is about 1/5 of the way on the way it goes up the second time. I know how much I don't know and how much that I need to reach out to experts if it's something beyond my comfort zone. So it's anybody who thinks that medical treatments on a snake is something that you can get off of a YouTube video that's done in the manner of this is how you fix your plumbing is going to be problematic, because I know the textbook this individual has read from, and they've picked and chose certain parts but ignored other parts, because certain parts they feel they have an understanding of, and the parts that they don't understand they're kind of ignoring. So it's problematic, to say the least.
I think if you don't know what you don't know, then I don't think you're never going to go through that cycle of the confidence drop, I suppose. I mean, that brings it on to the second concern that I really have with all this that's going on. We aren't naming the individual here because I want, once this video to come out, I want them to have a second opportunity to just wipe everything clean if they want to. And people that watch this will know what's going on anyway, because they'll know what's going on at the moment. But future viewers that weren't around when all this happened would have no idea. So I want them to have the opportunity to, scrub it clean if they want to. But this individual at the moment is uploading DIY surgery. And I'm not talking just squeezing things out. This is actual procedures, cutting things open with incisions. And I know you've looked at other things as well, but the first video I'd like to start off was a boa that was this individual's friend's boa, and it had a mass growing in its mouth. Now, to me, in this video, the person in question said that this animal came from 2 states away. This is me saying 2 states away. They actually named it, but I'm trying to not say where it's from. But yeah, so that has gone past exotic veterinarians to get there. And in this state they were in originally, there was at least 9 exotic vets just by looking at vet directories. So that they've bypassed actual exotic veterinarians to go do this surgery for a video. And there's a number of things in question within the practice within this video.
So let's bring up the elephant in the room. This is practicing veterinary medicine without a license. Now, there are things that you can do on your own animals that is legal, but it's a fine line between legal and animal cruelty. And unfortunately, the videos that I've seen, this is closer to the side of animal cruelty. The second is that you are not allowed to work on other people's animals. And they'll still sometimes give you a little bit of leeway, except for 2 small problems. This isn't just a friend who lives next door. This is somebody from several states away. Second, you are getting financial recompense because the video has got views on a YouTube channel. So you are being paid to do this procedure, just not directly by the individual. So this is already an illegal procedure. And I'm quite sure that some of the veterinarians in that state may be reporting that individual, and they're going to be in a little bit of trouble on that one. The second problem is that we have in this country and North America in general, a lot of people against the reptile hobby. They are looking for ways to demonize the hobby. And the fact that people are doing these procedures to avoid veterinarians, and there are lots of veterinarians in that area that are capable of doing these procedures, it basically makes the entire hobby look like just another version of Tiger King.
Shady is what it makes it look.
Shady, not concerned about the animal's welfare, but their financial bottom line. That these animals are products, not living creatures. And that puts the entire hobby at risk.
Yeah, I think the main concern is that it is a perfect. If I was animal rights, I could take this video and absolute run with it, because it's like giving you everything you've ever wanted, handing it to you on your plate, and going, there you are. It's literally perfect for you to just cause an absolute shit show. So,
the person himself, when he's doing this procedure, says, "I don't know if it's going to survive or not. Let's just try it." And then he starts talking about, well, I don't know what it is, but it could be this, it could be that, it could be this. Okay, first thing, when you are removing parts of animals, you need to know what you're removing. Second, you need to know how to remove it appropriately, not just take a piece of fishing line and tying it off. That's not actually removing the problem. That's what's called debulking. The mass is still there underneath where you tied it, and if it's a cancer, it's going to come back. You haven't gotten rid of it. You've just made it smaller. That's, you put an animal through a bunch of discomfort to not fix the problem. And the other procedure, you're literally holding an animal down and you're cutting through its skin and pretending like it's just minor first aid. This is full on surgery. You're digging around in an animal's muscle. So no, this is a painful procedure. There's no ifs, ands, or buts. And they did not provide any form of anesthesia or pain control. Or if they did, it certainly wasn't effective.
Yeah, yeah, in that second video that I hadn't even brought up yet, that you've just gone on to, you can actually see the animal like writhing in pain.
Yes, you can.
And you don't need to be qualified to recognise that. So if that video can be used by animal rights to rile up the general public, they will be able to recognise an animal writhing in pain. It's not difficult.
The question then comes up, if the individual can't recognize that that animal is in pain, but the general public can, has this person gotten to the point where they're not recognizing discomfort in an animal because they just want to get the surgery done or the views done? It's problematic on so many levels. This individual had views on that surgical video, which YouTube therefore paid him for those views. Why isn't he putting that money into the next animal that he videotapes? Because again, he's not saying that he doesn't have the money to do the procedures. He's saying he doesn't think it's worth going to a veterinarian. It's better that he does it. And that attitude of like, you can do a repair at home just like your plumbing. If you want to fix a toilet, go ahead. That is where the problem lies, because everybody that he's sending a video out to, anybody who's been keeping reptiles for more than 5 years, are in their head going to think that they are an expert and that they are qualified to do the things that he's doing. He's not qualified to do the things that he's doing. Yet, let alone the number of copycats that he set forth onto the reptile community, because you know that everybody out there thinks that now, because it was so simplified and so matter of fact, everybody who watched that think, oh, I could do that. And because he doesn't understand the pain involved or the physiology of stress and shock, because he doesn't understand even the appropriate use of antibiotics, people are going to think that they can do it.
At the end of that one where they're operating on that long-nosed viper, at the end he shows like literally the things like didn't close it up. Basically, it's got gaping wounds on its side and lacerations where it's sliced it up. And then he goes, right, it's going back in the enclosure. So would that have been closed up as a vet?
No, we would have sutured it as bare minimum. And you actually have to know proper suture technique on this, because of the fact that if you do it this way, it'll never heal. If you do it this way, it will never heal. You have to sew it in a pattern like this, where you fold the thing up, and that's how you seal it. So no, that was just open wound. So I should also point out his aseptic technique was very, very wrong. First, he takes iodine and he just paints it. And so what he's doing is he's kind of washing the bacteria all kind of like back and forth over the where he's going to incise. What you're supposed to do is kind of like do a line here, then a line up here, and a line here, slowly working your way out. So you push all of the bacteria away from where you're incising. So his aseptic technique on how he applied the iodine was wrong. Then he uses, so he does what he thinks is a great job of aseptic technique. And then he starts cutting with a blade that is not sterile because it's been sitting on a container, and he's not wearing gloves. So there's no aseptic technique. I mean, he handles hundreds of reptiles a day. There's going to be lots of bacteria on his hands. Even if he's washed his hands, there's still going to be bacteria from other animals. So his aseptic technique was inappropriate, to put it mildly.
They did comment on that and said they're not just going to show off to their audience, and the reason that they don't use gloves is because they like to get a feel for it.
Yeah, that's and you can complete this out. That's complete and utter. He uses the tools that he has available. And because he's throughout his videos, he's like, well, I'm going to use this antibiotic because of it's an old school, so it should work. Well, that makes no sense whatsoever. It's because it's what he has. He hasn't chosen an antibiotic based on cultures from the wound. He's just taking what he's got. And you can still get lots of antibiotics old school that nobody would use anymore. The other one is that you still need to keep this wound observed and clean. You don't just leave it open, gaping open. You need to seal it. Otherwise, your aseptic technique is completely useless, because the minute you put the snake back into the cage and it rubs up against something, bacteria is going to be into the wound. So that's why I'm saying there is no aseptic technique here. This is just for appearances. It's not actually functionally doing anything.
Yeah, I mean, just to go into the antibiotics, I know that you have explained to me that the antibiotic was an old time antibiotic that is no longer used and causes some problems.
Well, it is still used in specific cases. So the drug that he was using is a drug called gentamicin, and it is a absolutely wonderful drug for the type of bacteria that we'd be seeing. The problem is, it also is severely nephrotoxic. It damages kidney tissues like no other drug out there. And I'll use kind of this as an analogy. When you sent me this video and I watched it and my jaw picked my jaw up to the ground, I went to my associate who also does a lot of exotics, and I asked her, can you guess what antibiotic they used? And I gave the following. It's a gram-negative antibiotic, and it's old school and we don't use it anymore. And she went through several of them and she didn't get it right. And then when I said gentamicin, her jaw dropped to the ground as well, because no veterinarian is going to use that drug as a first-line drug, because it will fry the kidneys, especially in an animal in shock, especially in an animal that could be clinically dehydrated because it's suffering. So there's a lot of problems with that antibiotic. And here's the problem, another problem. He's blindly choosing antibiotics based on what he's got on the shelf, not what's best for the animal. If you were to really do an appropriate workup, if you were thinking you were dealing with an abscess, and they've done abscess surgeries, unfortunately, the first thing you do is you culture it. You basically grow it and find out what bacteria are in that wound and what antibiotics you should be using. Because the worst thing you can do is use an antibiotic that has no effect on the bacteria that's on there. And unfortunately, when I started in 2000, I didn't worry so much about that because I didn't have a lot of resistances in reptiles. I did in dogs, about a third of them were resistant. But I will say that in the last and I'll probably say 8 years, I've had to culture everything because almost every reptile abscess comes back resistant to 1 or 2 or 4 different antibiotics. And so I used to use Baytril all the time. I can't use it anymore because there's too many animals that are resistant to it. I'd still never use gentamicin, but that's just the way it is. So yeah, there's more to this topic than just like, well, I've got this bottle of antibiotics, so this is what I'm going to use, and just pray it works.
Going forward, I think that it's just because I think this individual has found a niche that gets higher views than usual as this medical miracle worker. And I understand why people enjoy it, because if you don't think about things on that critical level, you can just think, oh, they're saving these animals and it's wonderful. And I can see why people do give them the views, because it appears to be like doing a good thing. But I think going forward, it's with every next episode or video that's uploaded, it's just the next opportunity for animal rights to just absolute bulldoze us with it. I mean, if I go to USARK here, you have to excuse me while I read here. If I go to the USARK's Keepers Codes of Ethics, they literally state that USARK considers access to quality medical care and veterinary care to be required for responsible ownership. Now, what does that say about the US hobby when one of the largest players is completely just obliterating that?
And understand, I'm in Canada, and I'm sure that we're going to have a lot of people going through my CV and everything I've ever posted online to try and find dirt on me. And in Canada, we have a bunch of groups that are working against the reptile hobby. And as an animal welfare advocate, I've worked with these groups. I've presented for them, and I've commented on topics. The reason I work with them is because there are portions of it where I agree with them that we have to improve, and there are portions that I don't agree, which is that all reptiles should be banned. But the problem is that here in Canada, we are starting to see these very broad spectrum bans against exotics. They have in Winnipeg, they basically made it so that you've only got a certain number of animals that you are allowed to have. Leopard geckos. Actually, I don't even know if leopard geckos are on there. I mean, there's just like you're allowed corn snakes. It's like 4 species of reptiles. And this is hugely problematic because the animals that they're banning are usually not the ones that are a problem. The people in the hobby that are keeping unique species are not the problem. It's the people that go out and buy a bearded dragon from a large company that shall remain nameless, take it home for their kids so they have a pet Tyrannosaurus Rex in their kid's bedroom. And then when the kid gets bored of it 6 months later, it sits there and slowly starves to death in the corner of the room. And the problem for me is they account for probably 90% of the reptile owners in Canada. And these large corporations shouldn't be selling it. But the smaller ones, the ones that you see at the reptile shows, these are the people that are truly passionate about these animals. They're the ones that are leading the charge on animal welfare. So when you have one of the biggest players in the United States showing you that, we're just one step above large corporations on animal welfare, it really makes it hard. I rambled there and I apologize, but my point I'm trying to make is that here in Canada, one of the biggest problems we're having is that the politicians, the lawyers are all against the hobby. The one group we should be able to count on is veterinarians. And we're losing them because so few people bring their reptiles to veterinarians in Canada.
To skew perspective when all you see is the ones that are dying and not the ones coming in for regular health checks, because there's an attitude in the hobby not to bring your animal to the vet unless it's like on its last legs. Especially when things like this, it has also anti-veterinarian sentiment to it. Is that you don't need to go to the vet. You can I mean, one of the titles was literally about saving money doing it yourself and not paying a vet, and they had two prices of vet and then like dental floss or whatever it was. But we've fought so long as a hobby to drag the hobby out of this dingy, sleazy, shady view from the outside to work with veterinarians and make the hobby think about, has outlets of conservation, this and that, to bring it into a whole new view and to be something better. For things like this to be dragging it back, and it's divisive against the hobby and veterinarians rather than trying to build it together and solve problems. I mean, it just makes it easier for animal rights, to be honest.
Yeah, and the problem is they're winning because of these types of videos. They are in Canada. They are winning. We have already got multiple provinces that have banned a whole range of reptiles, including British Columbia. And I guarantee you that the area in Canada with the most reptile keepers, Ontario, is at huge risk because the Ontario government is looking at a positive list. And I know this because 10 years ago or 8 years ago, that's what they were covering at a symposium that I attended. They were talking about positive lists, that these are the animals you are allowed to have. And if we don't get somebody other than the reptile hobby, which I'm sorry, we're only a small percentage of reptile keepers, the people that will eventually have a say in government are going to be big box stores, because they have the lawyers to be able to say, no, we must protect the bearded dragons and echoes. We're not going to protect, say, some unique Sumatran lizard, because it's not in the best interest of those companies to protect them. They're not their customers. They're looking to protect, for mom and dad to be having a pet dinosaur in their basement.
Yeah. This video isn't to literally just drag the person. If you know who it is, you know who it is. But the idea is, just want the best possible scenario is that these videos are pulled by the person and they don't make them again. This isn't about destroy the individual. It's like, just nip this in the bud because you're going to damage everyone. That's all it is.
And I'd like to say that I have had conversations with this individual in the past, and I have full respect for what that individual and his organization have done for the reptile hobby. Total kudos. You have elevated this hobby in many ways beyond what it used to be in the 1980s. I'm just saying that at this juncture, where you're doing things that are out of your area of expertise, you may want to reconsider it, because, as I said, right now, you are doing things that are illegal and unethical and really problematic. So I don't want this to be me trashing the individual, because I do have an awful lot of respect for them, and a lot of people do. I'm just saying you've kind of gone off of where your expertise is into areas that you don't know what you're talking about.
This video will only come out if this can't be resolved behind closed doors, and a force of hand needs to be made, essentially. Because this cannot continue, because it will... I was going to swear then, but it will screw the hobby if this continues. Especially if this gets more views and more attention, because it's doing that. These videos are performing well at the moment. As soon as it falls into laps of animal rights because it's more on the radar, then there's a massive issue here.
Yeah. The good news is I don't think it's gotten onto their radar yet.
I don't think it has.
Yeah, I don't think it has, because again, some of them have, and this is where I say it's like I work all functions. I work retail, hobby, I work government, I work animal welfare, and I work with the hobbyists, and I also work with the animal groups that the reptile community don't like, and I totally understand why they don't like them. And I'm honest about it, because there are parts that as I said, there's overlap with my purpose of animal welfare and theirs. I also tell them, no, I can't support that. And they're fine with that as well. But I normally, they reach out to me. Some of the groups will reach out to me, and not the big one. I don't work with them at all. PETA, I don't work with PETA. They will reach out and ask me what the perception is. So since I haven't really heard anything from them, I'm assuming they don't know at this point.
Yeah, so it's best to just nip this in the bud now and delete everything.
And that's all I'm asking, because as I said, I still respect the individual. It's just they've gone a little bit far on that one.
I would like to talk about where exotic veterinary medicine is. Basically, I'd like to make the point of the 70s and 80s, maybe because it was relatively new keeping exotic reptiles. You'd obviously have like veterinary medicine would be like here, like pretty much level with the hobby, which is why there was a lot of DIY stuff back then. But since then, there's been an explosion of people specialising in exotics and people going past that and doing it extra years in school and specialising in reptiles. And it's up here now, exotic veterinary medicine. It's not down here anymore. So it's like that old school mindset of remembering back here when maybe that veterinary medicine was not up to scratch, and they say, "Oh, vets are crap," but actually, in reality, we're up here now. So it's an old school mindset saying, "Don't go to a vet now."
And for those of you who have been following the veterinary, and I will say this, when I was in vet school, and this was back in 1996, or no, it would be 1998. The level of veterinary medicine that was being taught to me was not great. I will be literally saying that I, as a hobbyist, knew more about veterinary medicine of reptiles than what than the person who's teaching the course. It was very, very bad in the 80s and 90s. Totally agree. But the truth is even in the 80s and 90s, you had veterinarians like myself that kept reptiles that wanted to do better. So we had the development of the ARAV, the Association of Reptile and Amphibian Veterinarians, who, if you are joined and you read through the papers, we're having leaps and bounds on the types of medicine that we're able to provide. We have a much better understanding of anesthesia in reptiles than we did, where we used to just kind of like inject them with cat medicine and hope they woke up again. So we are seeing steady improvement, and we now have board certified reptile veterinarians whose entire career are solely devoted specifically to the veterinary needs of reptiles. And there are now several in the United States, some close to where this individual lives, some closer to the person who shipped it across state lines to go to this individual. So there are opportunities there. But I think this brings up the elephant in the room as to why these are so popular is money. That's one of the things we haven't talked about. Even the individual says that he is doing this to save you money. This is highly problematic. What we are saying is that we will spend a certain amount of money for a certain genetic pattern. We'll spend tens of thousands of dollars for an animal that has certain genetic traits. We will spend thousands of dollars on caging and lighting. We'll spend thousands of dollars promoting our business, but we won't spend any money on veterinary care for these animals. What does that say about us as a hobby? Does that say we're in it for the animals, or are we in it for, and I hate to call it Pokemon, are we just collectors? That the actual individual animal's quality of life doesn't matter? Because just because we have to have them all, we also have to take care of them. And this is why your channel, which I have a huge amount of respect for you, pushing at a much higher level of care than we have done in the past. we need as a hobby to move away from that mindset that they're just disposable pets, because if they're disposable pets, we've lost. If there is no actual value to these animals, there is no reason that government, welfare institutions, veterinarians are going to support this hobby, and we are screwed.